Oh, yeah.
Whoa. So I have Paul here today. He's a new patient here in the office, and you heard about me through, I guess, YouTube.
Right? Yeah, YouTube for a friend.
And you say I have a friend that obsessed with watching stuff. He said
he's obsessed with watching anything with cracking.
Yeah, so he probably said, go to this guy, right?
Sure.
You have had a lot of chronic pain, though, right? You have sciatica down both legs. He also has 2 bad knees, ACL.
Meniscus.
I'm going to look at the alignment of the knees, but if he's got damaged anterior cruciate ligament, that's not typically a chiropractic case, but I will look at the alignment to make sure he's walking as clean as he can. And then you also have neck pain and back pain and mid-back pain and down the arms, right?
Sure.
Is one arm worse than the other?
This arm's always a little odd because I cut off a fingertip many years ago.
Hold that up.
And
so he's in carpentry and construction and
sure.
For years, right? Did you do it with a power saw?
Yeah, it was cut off with a power saw, and because of that, you got a lot of nerve damage in the arm. So that's all your nerve endings and in your fingers, you know.
So it's never right after that.
So yeah, the hand is never 100% right.
You were telling me before we started filming that you would really just help to be loosened up a little today.
Sure.
Right? And where do you have the worst spots of pain?
My stiffness is basically midsection, you know, more in the pelvic area, lower back, hips, like there.
Okay, because you did find out you had some herniated discs back when you did an MRI.
Well, yeah, I have a chip in one disc.
When he said chip, so the real word for that, chip is great because that's how I could picture it, where the disc actually has a chunk that floats away. And that's called a sequestered bone or sequestered disc. His chip, they said they couldn't even find. It's just gone. So that's horrible. But let's get working. What's with the breathing too? That's something you came.
So I get a lot of pressure in my head, and I get some sinus infections and stuff like that because the breathing out of my nose is so difficult or non-existent in some points. Almost like I always do. I do this. I can breathe pretty well.
So you want to walk around like that? You should duct tape.
That's what I say.
Like that, and then you're good, right?
Oh yeah.
That's easy. So I fixed it already.
There you go. Done.
All right. Well, I don't know what that told me, but let's do the CFR on you.
Yeah.
Okay. Lie on your belly. Put your nose right in there.
Awesome.
He's really strong. He's done construction his whole life, so I'm talking about this guy's back is strong. All of this is powerful back. And it makes it a little more challenging to adjust because this stuff is really, do you feel that pop a little bit?
Yeah.
Yeah. But you lift heavy crap your whole life, right? You probably still do.
Up and down ladders.
And a lot of stuff over your head where you're working with drills and tools above your head.
Sure.
So that's also a lot of stress and wear and tear on the spine and shoulders and back and neck while you're standing on a ladder. There you go. So now I'm digging in. What does this area feel like? Is it a little painful?
It's good, Joe. It's good.
He said it feels good.
When you're pushing down there, at least up there, kind of too.
So he's getting releases from me just pushing in here. It's releasing in other spots.
Yeah.
I'm not as strong as him, but I'm pretty strong.
Yeah.
I'm pretty strong. But I've also learned how to leverage my body to create a lot of force. Like right now, I'm putting a lot of my body weight behind this. Did you ever have anybody like kneel on your back or?
Not really.
Does that sound good to you or scary?
Sure, not really. Doesn't feel scary. Oh, there we go.
I'm going to interpret because his face is down, but he said, first he said, but then I interpreted that to, doesn't sound scary at all. You could do it.
Go ahead.
So this is, right now I'm starting on his upper butt, which is his SI joint. So there's not just his butt, but that's underneath that is where his sacrum is. Is that too strong or no?
Not at all.
It should feel pretty good.
Not good.
Because he's a big dude. And you need this type of pressure, right?
Sure.
Yeah. Is that too much?
No, not at all. Oh, yeah.
Now I'm right on his lower back now. Big breath in. Blow it out. We're going to move up the back. Now I'm at the thoracolumbar junction where T12 meets L1. That feels good too, right?
Yeah.
Did the other chiropractor do this?
No. Just
Oh my God. And I'll just keep moving up the back. You hear a crack?
Yeah.
I just cracked it. Big breath in. Big breath in. And blow it out.
Oh, yeah.
That was so loud. Big breath in. And blow it out. I did a gymnastic dismount. Did you see it? Where I flew my arms up in the air like Mary Lou Retton. Do you know who that is?
Yeah.
I liked Olga Korbut. That's how old I am. But everybody remembers Mary Lou because she was the American hero.
Yeah.
She was on the cover of a Wheatie box. All right, so now, look, here's his head. Grab the head like this, and I'm gonna stretch.
Oh, yeah.
Big breath in. You can put your head back. Another one. That was a big crack. Here, I'll show you guys a little trick, okay? So if you're doing the tool prong, you gotta be really careful you don't mess up, because if you roll this over his spine, he's gonna go, oh, you got my spine. So you'll see my thumb knows where the spine is because I'm on the spinous processes, and I create a little template for myself where I cover the spinous with my thumb. So if I roll, I hit my own thumb, which hurts, don't do that. But I'm protecting his spinous as I come up. That way I can generate a lot of force if I want. I'm pushing him really strong, but also creating like a little guideline so I don't mess up. All right, let's do this next. Paul, I'm gonna have you come stand up for a minute.
Okay.
And you're gonna sit right here. So let's check his shoulders. He's got pretty good motion in the shoulders. Let's do the other shoulder. Ooh, not so much on this side, right?
No.
This one hurts.
Yeah.
So let's do this. Head up straight. Boink. And I'm gonna come right in here into this trap with my elbow. And you're gonna feel this nasty spot right here.
Whoa.
Got it. Now, I'm gonna push the collarbone back up. And I'm gonna push the scapula from lateral to medial or left to right. I'm gonna come back in here deep, pull down on the humerus, release the first rib. There's that spot. You feel that one? Now, you felt that, right?
Oh, yeah.
And now look at the arm comes
Oh,
up.
look at that.
Isn't that cool?
It's pretty awesome.
Good.
It's
So
kinda
now,
weird.
you're gonna sit on this, let's do this. Sit over here. All right, let's do a nice occipital lift. Let this roll a little bit. Chest up a little higher. Good, let this fall.
Whoa! Whew. That was a good one.
I don't think that's cracked like that in years.
Oh, no, I just needed to do that for years. Oh, that felt great.
Now try the shoulder.
Oh.
Easier, right?
Yeah.
Right? Nice. Good, you needed that.
Oh.
Put your hands on your lap so I don't step on your hands. Big breath in.
Oh.
There's a little one. Let's do a little more.
Oh.
Perfect. Did the other chiropractor do that?
No, definitely not.
Definitely not. You know why? Because they don't teach that in school. They don't teach the double knee drop either.
No.
I learned that from professional wrestling. No, I don't know. All right, so we have more to do, so lie on your back.
That was nice.
All right, we needed to do this. Hands on your belly. Big breath in. And
oh my God. Oh.
whoa.
Oh, that felt awesome.
That was a lot of them, right?
Oh man. I think my neck is through a ½ inch.
Good. Okay. Let's do a little extra for his knees. I don't want to do too much on his knees because he just had injections in there. So I don't want to do too much, but I'm going to move the tibia back a little bit because he just had, what is it? It's like they put that, like they lubricated.
Like lubricated.
Yeah, they put a lubricant in, kind of like a gel-like lubricant, and when the knees are worn down to nothing, it gives him like...
Yeah, it takes it from bone to bone.
Yeah.
Like a little padding.
Gives it a little padding, and it's really nice for people. Got it. All right. Turn on your back when you do CFR, and we'll finish with that today, okay? Hey, Paul. This is Floppy.
Hi, Floppy.
You're gonna hold on to Floppy because it's perfect to squeeze.
Okay.
Floppy is my daughter's, but she let me bring it in. My daughter's 27 now, so she doesn't have Floppy on a daily basis. And I asked her, could I bring Floppy in so we have something to squeeze? And Floppy's okay with that.
Yeah, Floppy can only talk,
and myself, Floppy's been there, done that. He's been in the trenches. You know, some dogs claim to be support dogs, but we already know like that's not really true. Some are real support dogs, obviously, but some people like work the whole support dog racket.
Yeah.
Floppy, here, let me borrow Floppy for a second. Floppy is a real support dog, right? You really do your medical work, and Floppy is trained and is there day to day in a doctor's office. You said your right side was worse, so we're gonna start on the left side. We always start on the easier of the two sides. When I put the balloon on the left side, I'm gonna say, open your mouth, take a breath and hold, and it looks like this. That's it. I'm pushing this back. That side's messed up because you have a deviated septum over there. Woo, that's tough. There it goes, I finally got it to go through.
Man.
Big breath in and close your lips. Got it.
Holy crap.
Do you hear a crack?
Holy crap. Oh, everything cracked. Oh, man.
You did good. That was scary, but you're brave. Point to where you heard a crack. Like point to the part of your face.
My whole head. My face, my nose, in here, my eyes.
You heard cracking, right?
Oh, man. You felt it all the way up here like this.
That's your good side.
Yeah.
We're about to do the other side. Do you still want to do it?
Sure.
All
Let's
right.
go for it.
There it goes. All right, whenever you're ready, big breath in and close your lips.
Whoa.
You did it.
Whoa.
You're one of the toughest cases I ever worked on.
Oh, man.
And I've done a few thousand of these. Which side popped more, the first side or the second side?
The first time we weren't expecting it, so I guess the first time felt like a lot more popped. You weren't expecting it. You don't know what's going to happen. The pressure goes to your ears. It's almost like if I know it's, but like exactly what you did. It's kind of like you pumped my head up like it was a balloon, you know, and it just went, you know, so like the pressure goes and then it just releases.
All right.
And it felt good.
So you did that today. You did the Y strap. We climbed and did your back. We got you with the double knee drop. And what else? We did your lower back with the drop table.
Yep.
So it was really good.
Yeah.
All right, man. Thank you so much.
Nice meeting you. Thank you so
All right,
much.
Take care.
That's scary. Oh, there we go.
I'm going to interpret because his face is down, but he said, first he said, but then I interpreted that to, doesn't sound scary at all. You could do it.
Go ahead.